Welcome to the Aesthetics Unfiltered podcast. We are Michelle Jones and Melanie Torres, two leading medical aesthetic nurse practitioners and great friends based in California. We uncover the inner workings of the booming aesthetics industry from both the patients as well as the providers' perspectives.
Join us for the authentic conversations about current and trending treatments, best practices, and the real issues people face with modern beauty standards. Any information or advice given is general in nature. You should consult with a healthcare provider before undergoing any treatment.
Hey, you guys, welcome to episode 6. We're talking about neuromodulator myths and truths and breaking down common myths that we have in the clinic that patients ask us that are not all the way true. So we're just going to break that down for you guys. Hopefully this will be a fun, short educational piece. I'm Michelle Jones. I'm your host today for Aesthetics Unfiltered. And we have our co-host, Melanie Torres. And we are here just on a Saturday filming for you guys. How was your week, Mel? Everything good?
Everything's good. Yep. Just enjoying life. Yeah, I'm pretty good today. I'm going to go to my ballet. I take ballet. Like dancing is like my new passion. I used to do it when I was younger. And we're going to my adult showcase. I'm not in it this year just because I've been doing it for maybe 7 months again. So and any adult can be in my program, but I was like, I'm going to do it next year. But anyway, I'm going at 5 to go see all of my colleagues and all my classmates do an adult ballet showcase. So I'm super excited.
I love that. I'm so jealous. I know I have a dream of dancing and doing taekwondo, but I can't seem to get there.
What are you doing this weekend? What are you going to do this weekend?
I'm just resting. It's been a rough week. I want to lay in bed, watch bad shows, and do some yoga, honestly.
Good. That sounds
and order some food. It's been intense. I got to pet the cat. Whisker's still hanging in there, but I honestly think you guys, she only has a week left, so it's really hard.
Oh my God.
So this is good. Distraction is amazing for me. I'm on 3 espresso shots. I'm ready to rock. So thank you for distracting me. Let's do this.
Okay, cool.
Let's go over what are some common myths with our Botox and things we hear in the clinic. So I'll just say there's Botox is kind of like the brand name. It's kind of like Coke versus Pepsi or Kleenex. There's a few different neuromodulators on the market. There's Botox Cosmetic, there's Dysport, there's Daxxify, there's Xeomin, and there's Jeuveau. So those are like the 5 most common ones. In my practice, I mainly do Botox, Dysport, and Daxxify. How about you, Mel?
So we carry at my clinic, we carry Botox, which is the number 1 neuromodulator. It's called neuromodulator or neurotoxin. Those are used those are both the same clinical names for Botox, Dysport. So anyway, here at my clinic, we use Botox, Dysport, and Xeomin, just because Xeomin was marketed as natural. I literally do Xeomin maybe 4 times a year, but they all work great. I love Botox and Dysport. I use them interchangeably. People have their own preference, but they are the same. All of them are made from the same bacteria.
You can see I have big Dysport energy on my shirt today. Obviously, I'm a fan of Dysport. I'm just bringing it. I'm really into my t-shirt things right now and how I feel. But yes, I love my Dysport. I love my Botox too. I usually do mostly Botox and Dysport in my practice. I do a little bit of Daxxify. And basically Botox and Dysport are like the biggest brand names, I would say. And Daxi came out 1 or 2 years ago. I can't remember. I think it was a year ago. We can go into what that one is, but it's a little bit different because it has an extra protein in the mix, and theoretically it can last a little bit longer. It does. Most people, it does last longer in the glabellar area. That's where the study was. And Xeomin I haven't used, actually. I know that's been around for a long time, and from what I've taken away from it is it doesn't have any free extra proteins in there, and it's a little bit softer.
Yeah, I see that.
Is that right?
Yeah, it's a little softer, and people, I don't get a lot of people being like, it's amazing, I'm only going to use that. The one of my girls that came in, she wanted to start with that. She'd never had anything before. She did it and it was great, but then you know, and Allergan does this a lot they have the biggest market share, as they give really great promos and stuff through their Loyalty Ally program, which is an amazing program, by the way, but they have a great corporation. They know, and because Botox is like the name everyone's familiar with, she was like, oh, I'll try it because they had a promo for it and she likes it just as much. And so now she's doing Botox. But, you know, I think if you were stranded on an island and had any of these brands and it was the only brand available to you and it made you look great and relaxed and amazing, I think anyone would use any of these brands.
Yeah, they're all pretty similar. I mean, yeah, I think Dysport has good promos too. So, I mean, I've never had anybody come in and ask for Xeomin. Like I've never had that. I've had people come and ask more for Dysport over the last 2 years. It's interesting. It's more, people are more aware of it, I guess. But yeah,
I
Botox
honestly
is still
think
amazing.
it does. I feel like Dysport does kick in a few days earlier than Botox, but again, it has to do with the patient. Exactly. Yeah. So that's a myth that it's always going to be stronger and kick in more. It's like all these toxins, and even though it's called a toxin, it doesn't mean it's poisonous or anything. That's just originally the botulism toxin was toxic when it was used directly in wars and whatnot, but it's diluted so much. It is only a little bit of the toxin we use now.
Yeah, I mean, Botox is the most studied medication probably on the planet. Honestly, it's been used since I think the 1980s, and you know, it's a neuromodulator. So I don't even like to use the word toxin but it just helps relax the muscle and kind of cleave off the nerve muscle junction. And we can go into the science on that on a different episode of exactly how it works, but it temporarily just relaxes the muscle, and then your body breaks that down over 3 to 4 months typically. But it's very safe. I mean, it's been around. Like I said, it's probably the most researched medication on the planet, and it's, you know, I think we could go into like what has worried me is the kind of, as of a few months ago, people have been using fake Botox out, and I don't know the whole thing on that, but that could be a different animal because we don't know where that Botox is coming from. It should really only be sold from Allergan, which is the pharmaceutical company that makes it. And if you get it from anywhere else, we don't know the toxic threshold of that medication. We don't know even if that's a legit medication. So that would be my only like main safety concern. Of course, there's a million clinical trials with Botox, and you guys can read about that, but it's a very safe injection. In fact, I don't think I've ever seen an allergic reaction to it. I've been doing it 12 years. So yeah, it's very safe. I mean, there's a threshold that you don't want to go over, but even neurologists are doing like probably 200 to 300 units for like chronic migraines in the scalp, the base of the neck for patients. And usually the cosmetic dosage I'm doing is anywhere from 20 units up to 150 units. So it's I think if you're staying within the threshold and the person doesn't have any contraindications to it, mainly like myasthenia gravis, anything where you can't swallow or your muscles are not responding properly. If you have any facial weakness on your face, you want to be a little bit more careful. But or if you have an active infection, you shouldn't be injecting Botox. And there's like one class of antibiotics that could potentiate the effects called aminoglycosides. But besides that, it's a very safe product. I'm going into your topic. I'm sorry, Mel, is Botox safe? I'm sorry.
No, it's totally fine. No, the next one that I think is a great myth that you can talk about is Botox will give me a frozen or no expression when you inject it into your face.
Yeah, you take the lead on this one.
Okay, so Botox, honestly, I have never injected into someone that says I'm frozen. So there's standard guidelines that the pharmaceutical companies give you, that is the standard amount to do in certain areas. So the on-label areas in the forehead, the glabellar, which are the frown lines, the 11 lines, and then the crow's feet. I've never had anyone, when I do the clinical dosing, the one place that people say you can look frozen or expressionless is when you do many units in the forehead, but most people like that. I've never, and a couple of times people will be like, oh, I was a little bit too tight, because a lot of people like natural movement, and everyone's muscle absorbs the medication differently. I need like a lot of units in my forehead to make it go completely frozen. Some people only need a little bit amount. You have to like start low, see how you like the result, and you can always add more. But for the most part, no, you're not going to look like these scary people online and in, you know, celebrities and newscasters and stuff. Like naturally, for the most part, you will not look frozen or expressionless if you do the standards amount of the Botox or Dysport or any neuromodulator.
Yeah, I mean, I think there's a lot to unravel on here. I think if, you know, we don't know what we like until we try it. And I think it's really like, I call your Botox or neuromodulator treatments a recipe, and we got to figure out your right recipe that you like. And everyone's recipe is going to be slightly different, and it depends on your preference for like the feeling of tightness. A little, you know, some people want a little bit of movement, some people want no movement. But the thing is, even if you like completely knock out the movement, it's only going to last probably for 2 weeks, and then that muscle starts loosening up, and by like 4 weeks you'll be at that perfect spot where you have a little bit of movement, but it's still a little bit tight, and that's what most people want. I think the number one thing people don't want is just to feel heavy on their forehead, because even though sometimes it doesn't look off, they might feel like it's off. And if you just like totally knock out that forehead muscle, it's more of the feeling that stresses people out rather than how it actually clinically looks. You know, if you're doing Botox and following the facial anatomy, and there's a whole art on that, it should look very natural. But if you like are winging or spocking up someone's brow, then it's obvious that like things are out of proportion and we need to correct that. And that's easy to correct. So yeah, it's really an art. Something that I tell a lot of patients is patients are always concerned with looking natural, or looking unnatural, sorry. And they want to be like, oh, I only want to do the glabella area between the eyebrows, or I only want to do the forehead. But I think people look more unnatural when you're just knocking out one area, because all the other areas become hyperdynamic. And then for me, it looks strange. It's like, if you only do between your eyebrows and your forehead, your crow's feet are going to naturally probably contract a little bit more, or, you know, that's all I see. And it's funny because I end up seeing that on patients, and I'll point it out, be like, hey, we've been doing your forehead, your glabella for the last year, but all I see are your crow's feet now. Are you interested in that? And I think if you do a little bit symmetrically all around, it looks the most natural. What do you think, Mel?
I do agree with that, but with mine, it depends on the age of the person. A lot of people like crow's feet, like it doesn't bother them to have crow's feet. You know, you can always do like a baby amount in it. So dose equals how the amount of units you do equals to how strong and like frozen or less movement you'll have. So you can always do just like a little bit if you do your glabella in your forehead, just like a baby amount in your crow's feet. So you'll still have movement in some of the crow's feet. They just won't be as strong. So
I agree.
Just a baby amount. It definitely, to me, looks weird when you just do either the forehead or the 11 lines and you don't do a little bit in the other area, because your forehead will be like moving a lot, but you won't be like moving your brows as much. I think it's an art. I think it's important to, when you find a provider you like and you like their results, stick with that person, because they will know what the dosage was on you. But if you jump around to get the best price from different places, you're not going to keep getting the beautiful result you got that first time. That's something I recommend. And then always, you know, don't do too little, because if you're like, I only get like 6 units in my glabella, it's only going to last for like a month, and then it's not really worth it. You might as well get a result that the FDA, they say it lasts for 4 months. That's what the FDA says, but that means that's when it's completely out of your muscle, and your body, your face and muscle movement will be back to exactly the way it was before you ever got the neuromodulator. So sometimes it lasts for 4 months on people, especially when you first start doing it. I feel like it lasts a lot longer. But some people, if they run every day and are angry and hate their jobs and their partner and they're scrooching all the time and they're stressed, it can wear off after like 2 months. And it depends on everyone's own metabolism. So sometimes it can last 4 months, sometimes it can last 2 months.
Yeah, I think everyone's, dose equals duration most of the time. So if you're doing like if you're underdosing people, you just have to have that conversation. So the expectation is there of like, hey, like this might only last a month to 2 months. Are you okay with that? And also you don't want to treat people too frequently because theoretically that could, I don't have an article to prove this, but it could increase your chance of like antibody formation, and you might get a higher resistance to the product and it might not last as long. So I try not to retreat people sooner than 3 months personally, even if it's a baby dose, just because the more frequently I'm treating them, the more their body's just going to get used to the product. And I'd have to look up an article for that for you guys, but that's what I see in my practice. I put myself on a timeline. I'm not allowed to do myself unless I really fuck up my face. Sorry. If I drop my own brow, which I've never done, or I've spocked myself, then I'll fix it. But I try not to treat myself sooner than 3 to 4 months, just because I don't want to build up any resistance on myself.
Right.
So I think that's good. But yes, looking unnatural. I think you'll only look unnatural if like you get it's called Spock brow, where your eyebrows are really lifted or something's out of proportion on your face and not moving naturally. And most of the time we can fix that if there's movement. But if you're, it's rare for people to be too frozen unless you're feeling heavy on the brow, and that would be like too much on the forehead, and it's really technique and dosage related. But yeah, I think most people are amazed, even with a high dose of Botox or any neuromodulator, that they actually look very natural. Yeah. How much do you have in your face right now, Mel?
The last time I did Botox, and it's hard with these cameras because they make everyone look better than they are. So the last time I did it was around the end of May. So I did it, so I've done it like 2.5 months ago. So my dosing, I usually do around 48 units in my face. It depends. In my upper face, I usually do this. My forehead needs a lot. I usually do like 14 to 16 units in my forehead of Botox. Here I do 16. My 11 lines aren't that bad. The FDA dose is 20 units here. And I feel like the Botox lasts the longest in the 11 lines for me. Sometimes I can do less if I have no movement there, but I always treat them every 3.5 months. And then my crow's feet, doing filler really helps crow's feet. So even though I'm almost 50, because I've had a lower blepharoplasty, and B, I have filler and stuff. So one of those too. Yeah, my crow's feet aren't that bad. So, I usually do about 48 units in my face. And then the Botox that I love the most is micro neck Botox, because now I'm starting to get baby laxity on my jawline. I love doing the platysmal bands. I find that's something that makes women look like way older, especially if you're thinner, is to see those muscles, those lines come in. So I love doing my neck. And I also do my masseters because I grind my teeth. So like you said, some people do up to 150 units. Because I treat my masseters, my neck, and my face. So that can be like 150 units, but I do it easily spread out. So on average, 3-4 times I do about 150 units 3 or 4 times a year for everything.
The full face,
yeah, full face, neck, and masseters.
I'm like with you. I do about 50 units between my crow's feet, my glabella, and my forehead. That's like pretty standard. And this is Botox units. We're talking Botox because every unit is different. So sorry to confuse anyone. I like to do a lip flip. I do like just 4 units, like a baby lip flip, a Botox. I do my DAOs, these little sad muscles here. Mine are really strong, but I feel weird if I do too much. I know it could give me a better result, but I use my mouth so it's just like feels weird. So I usually do like 3 Botox units. I do my chin. I do like 6 units of my chin.
I love chin.
I don't want my face to be any slimmer, and I'm like the one person in the population that doesn't have TMJ, and I'm so lucky.
Oh my God, I'm surprised.
I don't know how I don't have it. Thank God.
I can't believe you
I don't know
grind
how.
your teeth.
I'm
What?
grateful for that one.
Amazing.
And I like doing these little bands here. I have like neck issues, so I don't do a lot in these muscles because I need these muscles because I was a gymnast and like my whole back of my neck is messed up. So I'm just going to have some ugly bands here, but it's fine. The last thing is the jawline, like Nefertiti lift I'm doing on everyone now. And I do like 8 to 9 units superficially on either side of the jaw. That really helps.
100%.
We can go over that. So yeah, probably I'm up to 75 units, girl, maybe 80.
Yep.
We're all lying.
Yep. So yeah.
I only do 50, bitch. I'm doing 75.
So you can always start, go by the provider's recommendation. If you, cut 50 units for people in their 40s, 30s, 40s, 50s, 50 units around for your face is like standard. So don't get scared. And I would just, you can always do a little less in your forehead to start off with to make sure your brows don't get heavy.
Yeah.
And then you can always go back and get a touch up in 2 weeks because it does take 2 weeks for the entire full effect of these neuromodulators to take effect. So sometimes they kick in a little early, but I always tell people to wait for 2 weeks before they get a touch up. Because sometimes randomly the neuromodulator will like kick in like 10 days after you get it. It's random, but sometimes occasionally it can do that. So 2 weeks is the best time to do a follow-up and get more.
Yeah, and that leads me just to plug Daxi a little bit. Daxi, I feel like by day 4, this is like it kicks in like 90% by day 4, and then it takes another 2 weeks for that other like 10% to fully kick in. It's interesting. So if you're doing Daxxify, that's one of the bonuses of Daxi is it does kick in pretty quickly. Unlike the other neuromodulators, I would say Botox and Dysport, it's like 10% each day. Sometimes Dysport kicks in a little bit faster. I'm going to plug my Dysport units just because everyone gets confused on units, and I kind of want to do an educational piece.
This is a big confusion, so I think it's really good.
Do the your units, dosing. When I train people, I'm confused with their units too, because like there's basically like on label how you are supposed to like mix Dysport is you can mix it the same exact dilution as Botox, which is 2.5 mLs of normal saline. So Dysport, I do 50 units in my glabella. It's like 10. Each little point is 10. There's 5 points. So 10, 10, 10, 10, 10. And on the forehead, I typically do like 30 to 40 units on my forehead of Dysport.
Me too.
And then around the eyes, I do 30 because my eyes are really strong. And typically like Dysport's like 3 times Botox amount in terms of units. If you're kind of thinking about them, it's close to 3 times. So the Dysport units don't really equal Botox units, even though like 12 units of Botox around the eye would be like 30 units of Dysport, somewhere around there, like pretty close. And then Dysport, I would do like 10-10 I would do like 5-5 on my lip flip. I feel like it's a little stronger for some reason, like it kicks in faster, it spreads a tiny bit more. So that's my Dysport plug. The units, all you need to know out there is the Dysport units don't really match the Botox units, and it's a little bit confusing for the patient, and this is probably too much information for the patient, but typically like Dysport is like 3 times Botox, because Dysport comes in a 300 unit vial and then Botox comes in a 100 unit vial, and they're kind of equivalent. So if that makes sense.
That's a good way of looking at it for sure.
Yeah. So we went over myth 1. You're going to look unnatural, and we kind of dispelled all of that, right?
Yep. We also did, we did the Botox will give me a frozen or expressionless look. We just did that one. We did the duration one. So what, do you want me to do another myth, or do you want to do one, Michelle?
You can go for it. Go to the one about, a lot of people get depressed that they're after doing Botox or neuromodulator, that they still have a wrinkle between their eyebrows or around their eyes. And you can talk about why that is.
Okay. So there's a myth that if you do Botox, all of your wrinkles will 100% go away. Even if you do a full treatment of Dysport or Botox or any of the other brands, sometimes you will still have a line there because you've been using your muscle for years and that line is etched in. So it's called a static line, especially as the longer you wait to do Botox, the line is already deeper. So even though you might not have as much movement, you'll still see the line there. Usually if you do it a few times, when you start, on average, I think it's good to start doing Botox occasionally, like in your late 20s, early 30s. That's when I'm finding people, it's the average age when people start. Do it once or twice a year if that's all you want. You don't have to do it every 3 or 4 months. It's when you want to do it. There's no rule that you have to, but the more you do over time, that static line may disappear because you're moving the muscle less. That's a truth, as if you start younger, you're never going to get that etched in line because your muscle won't be flexing so much. But yeah, and it's normal to sometimes have a line after Botox, even after you do these treatments, but overall you'll look refreshed and you'll have less movement overall. So those lines won't be getting etched in so much.
Yeah, I'll be preventative. Yeah. I usually do like what's called a stretch test. So you'll stretch the skin and how much that skin is able to stretch. If you're still seeing that line probably won't go away. But if that line goes away when you're stretching it, then you have a good chance if you're consistent with your Botox to get rid of that line. So I think we have the conversation with patients. Are we trying to correct this line? Or are we trying to prevent this line? And if we're trying to correct, we need to see you at 3 months because we got to get that area tight. And sometimes I will even use a little bit of Daxxify if I feel like it's just really stubborn. Sometimes I'll put smooth threads in there. As a last resort, I would do a little filler, but it's the highest risk of blinding someone, even though it's so low. But I would use an ultrasound. I usually have patients be consistent with a neuromodulator for a year before I entertain that thought. That's just my little safety rule. And I would use an ultrasound, start slow. But yeah, I think we have to have that conversation with patients. It's not, if it's really etched in, it's probably not going to go away after one treatment. I feel like the younger generation, your 20s and 30s, you're still building collagen. So theoretically, that skin is going to bounce back way faster than someone in their 50s, 60s, even 40s. So their etched line in their 20s probably will go away way faster than somebody in their 40s, 50s, 60s, just because their skin has more collagen. It's going to bounce back, has more hyaluronic acid. So you bitches are lucky in your 20s. That's all I say. Gotta keep it entertaining for y'all. Anyways, yeah. So yes, not all your lines will go away unless it's dependent. So,
Totally.
but yeah, if you have an etched line in your 40s and 50s and 60s, you got to be consistent, and we might need other treatments. But if you're in your 20s, you have a good chance.
Yes. Michelle, I would say that it's not normal to get filler in this area. This is the highest risk area. So I would recommend not getting filler in around your brows or eye area because it's a very high risk area.
Yeah, I mean, if I was ever going to get that done, I would have someone who's using an ultrasound, and I just wouldn't do it without an ultrasound now. I wouldn't. I think now we have the technology, so just be safe if you're going to get that done. It's still extremely low risk, but it's still a risk. And everyone's risk tolerance as injectors is different, right? It's like surgeons, the risk of having a surgery is death, right? For us injectors, it's we don't have that risk tolerance. At least I don't. I'm keep it simple. I like to sleep at night. Even though it's an easy injection for me to do I want to take the risk? And I don't think it's worth a syringe of filler for me, the price. So that's just me.
Yeah, I would never do it, even though you're right. It's very rare that happens. I just get too scared to do it. I don't know. I actually have an etched in line. It's very minor. And we get nitpicky after a while. I've never had filler in this area. I've had it over my lateral brow a little bit because there's less vessels there. I've had it in my temples, but I'm too scared to get it here or give it here, even though it's not usually a problem. I don't do it.
I've done it before and it's looked great, but I have to have trust with the patient. Use my ultrasound, go slow.
Well, maybe you'll do mine then the next time I see you.
Shit. All right, fine. All right.
All right.
Moving on. The next one is you, Mel.
Our last Botox truth and myth. Let's see.
If you stop doing Botox, the wrinkles will get worse.
Right.
Once you start, you can't stop.
You can stop at any time. I do agree. I think there is a truth is if you don't do it, you're animating more and more. So I feel like your wrinkles do get deeper and deeper. Say if you've never done Botox, that's my thought, but everyone does Botox now. So I actually don't know the answer to that. But if you do Botox consistently, muscles have something called muscle memory. It's the same as if you work out and do a lot of exercise. If you work out one muscle all the time, that if you stop working out and then you start again, that muscle will build up quicker because it remembers how to do those movements. So if you I don't get 11 lines that much because I've been getting Botox here for so long that my muscle is a little smaller there now because it hasn't been building up and getting stronger. So I don't move my brows as much anymore, and so I don't need as much Botox there. What are your thoughts on this? What are your thoughts about if you stop doing Botox, all of your muscles, all of your wrinkles get worse?
I mean, I think it's total BS, but I think it's complicated, right? So there's no way to prove this, but if you're doing Botox and you're doing it for 5 years and then you stop and then you're going to see all your movement, you're obviously going to think that it got worse because you've never seen wrinkles on your face. Let's be honest. So who knows what you would look like if you didn't do it? So it's crazy. The muscle's going to get a little bit, like you said, weaker from doing your Botox. So, it's what I've seen is, say you've been doing Botox for 20 years. This is the only thing I can maybe think of is like our skin's going to be thinner and our muscle's going to be a little weaker. So when we lift our brows, we're going to see a lot of little tiny lines, maybe in your 60s or 70s if you've been doing Botox for 20 years. And to knock out those little tiny lines, you might need like a bigger amount of Botox, but also we're aging, so you'll probably need a little bit more Botox. Will your wrinkles get worse? There's no way to prove that. It makes zero sense unless the muscle's weaker and it's just creating those little tiny crepey lines rather than the big, thick, like static lines when you have a thicker muscle. But you're also a lot older, so I think it's crazy. There's no science on this as far as I know. I think where it stems from is when people are like, they've been doing Botox for 5 years and then they haven't never seen their face fully animated, and then they see their face fully animated and then they say it got worse. It's ridiculous. That's your fucking face.
Right. And it's also because they're used to not seeing the wrinkles.
That's your
so
face
they look
moving.
Worse. Right.
It's not worse.
Well, my forehead muscle, my wrinkles come back. If I don't do it for 4 months, I still get a lot of wrinkles. I just have a really strong frontalis muscle that even though I've been doing Botox in these muscles for almost 20 years, on and off for 20 years, my frontalis muscle is still really strong. I don't know why, but you can just do some Botox or Dysport or Daxxify or Jeuveau and they can settle again. That's why this is such an amazing medication.
Yeah, I definitely don't think it's worse. I mean, that's crazy. Why would we be doing Botox or neuromodulator if it's going to make it worse? There's no science. That's ridiculous. I think if you stop, you're just going to notice your wrinkles and it gives you anxiety. So the only other thing, like I said, is like if it's 20 years in, 10 years in, and the muscle atrophies, which it normal atrophies with age, but maybe the Botox or neuromodulator can atrophy it more. Theoretically, that skin's going to move more and you're going to have little tiny lines as opposed to like a thick muscle, which is just a few lines. But that also just could be age, and there's like no way to prove that. So I think the real thing that we see is at rest, when you're consistent with your neuromodulators, the lines look way better at rest over time. I mean, I had more lines at 32 than I do at 40 right now. So I can tell you as a fact, even when it wears off, I look better than I did when I was 32. So
the static lines will not get worse. Exactly. I totally agree with that.
And it's the other thing is once you start, you can't stop. I mean, dude, we're in control. Like, come on, like you can stop. This is crazy. You're in control. You could do this twice a year preventatively. You could, obviously as injectors, we recommend you to do it more frequently for the best anti-aging like results. But I don't know why people are like, once you start, you can't stop.
I think
you're
it's
not gonna wanna
psychological.
stop.
It's psychological because you look better. Most of the people
Right.
like the way they look with Botox, and it gives you a feeling of self-confidence, and so you want to keep doing it. Like I'm kind of addicted to it a little bit because it makes me feel good when I do it. But I think you and I should do a challenge if this podcast really takes off. And, we keep doing it for seasons and seasons. We should both not do Botox for like 6 to 12 months, if that's possible,
God.
to see
Okay.
what we look like after
Okay.
6 months. But maybe let's do a 6-month challenge where we don't do Botox, because this is the
Okay.
opposite of what we should be doing. And then we can prove our point.
Oh no, where'd you go, Mel? All right. Well, I'm going to keep going until I hear Melanie. And I think she got kicked off of the internet. So sorry. But those are most of our Botox myths. So let's recap. Botox can make you look unnatural or a neuromodulator. I think what we found is treating multiple areas can actually make us look more natural. And it is a recipe. So work with your injector. Neuromodulators can make your wrinkles worse if you stop. I don't think there's any science on that, but I think if you stop, your wrinkles are naturally going to look worse. Is Botox safe? Toxic amounts? I mean, we talked about basically it's the most studied medication. Make sure it's from the pharmaceutical company and the actual legit reputable source. You should stay within the standard dosing. And really that can be, in my practice, it's usually up to 150 or 200 units, and neurologists do up to, here she is, 300 units. Hi.
Hey, my phone just fucking died. I'm plugging it in right now.
This should be on the podcast too.
I know, this is so annoying. If you're still filming,
I
my
am.
phone just died.
It's okay. I'm wrapping it up.
Okay.
Yeah.
So what should I do right now? Do you want to wrap up this
Why
episode,
don't
or
we
else-
just, charge your phone up. I'll wrap it up. And then, we'll take like a 15-minute break and then we'll go into the last one.
Okay, so you're going to wrap it up right now?
Yeah.
Okay, cool.
Yeah. Okay.
All right, okay, cool.
Call me
I'll
in
be back
20.
in a sec.
Okay. Bye.
Okay.
I don't know if you guys heard that, but Melanie's phone died. We've been filming for 2 hours. We're on a roll. So send us your neuromodulator myths, your Botox myths. We're here for you. We want to answer questions. And hopefully we can help solve some of those, debunk some of those myths. And you could follow us at skin.smarty.np on Instagram and melanie.skinnp on Instagram, and also aesthetics.unfiltered.podcast on IG. We also will be uploading to YouTube, and I'm trying to build my TikTok. It's not great, but I'm trying. So follow me there. And next episode will be a juicy episode about drama in the workplace, especially aesthetics. All right. Until next time, I appreciate you all. I love you all. Give Whisker some love, and I will hold her up for the last podcast or the next one so you can see her grumpy face. Okay, talk soon. For our latest news, follow us on Instagram at aesthetics.unfiltered.podcast or in our personal pages on Instagram.
Mine is melanie.skin.np and Michelle skin.smarty.np, both on Instagram. Have a great day.